Welcome back to the Younger Body and Mind podcast. We're your hosts, Melissa Whitkey.
And I'm Billy Greer.
I'm Dr. Habib.
And today's episode is going to be a very powerful one. We're talking about something that affects every one of us. It's aging. And we're not going to just talk about aging in years. We're talking about aging in cognitive ability, in energy levels, clarity, strength, and confidence in your own body.
And oftentimes there's a negative connotation about aging, and we're here to shatter that. We're here to say that that is not the inevitable outcome of aging. So I'm hoping you're going to stay tuned today because we have a lot to cover. So our guest today is Dr. Habib, the founder of Next Health. He has a clinic that's at the forefront of longevity and health optimization, and we're so excited to speak to him today about what he can share with us on our journey toward the younger body and mind, which is something that we've spent quite a bit of time on. And we know our listeners are interested in that as well.
Right, so we're going to look at some of his work in reshaping the way we think about aging. And we're looking at aging and wellness using science, using data, and powerful tools to help people to live longer and better.
And I think one of the things Dr. Habib, if I read that you talk about, instead of lifespan, it's health span.
Sure.
And that's something we want to dive in and share with our audience because that's something that resonates with Billy and I. And we share that on a regular basis. So are we ready to dive in?
I think so. Let's dive into it.
So, Dr. B, we would love to hear about your medical journey. Now, you started from England, and you're here with us right now in the U.S., optimizing health for all of us who are listening. Yeah. But I'm really interested in hearing you explain your term of rethink medicine.
Yeah. Well, we can start with that, rethink medicine. I think the way I'd say it is, if you do what everybody does, don't expect a different outcome. The medical profession is very, very slow. And the reason I know that is because I became a doctor in 1993. I go to the hospital now, whether it's for my mom or due to other patient interaction, nothing has changed. If anything, people are just sicker, and this is where Healthspan comes into it. I'll make a bold statement right now, which is 100% true. If you have health, you cannot get disease. If you have disease, you cannot reverse it without building health, what we describe as function. So what we do now is what's called functional medicine. So when you said rethink medicine, that's what I coined the term. But functional medicine was here before I was. But it's really helped me understand, and where I think I fit into the bigger spectrum is that I can connect the dots between the preventative and the disease and everything in between. And that's why I'm really excited to be here to share with each other, because you live it. Because when people talk about aging, the first thing is about looks. There's no way around it.
Right.
But then movement. So they're both important, because what goes on the inside will determine how you look. What goes on the inside will determine whether your joints work. Where does the inflammation come from? Where do these arthritis come from? And then the most important one now is the function of the brain. It's coming very rapidly in a bad way, but it's not a totally alien concept. It's all coming from the inside. The thing that makes you look older, the thing that makes you feel older, it's making your brain older. We can assess these things like we couldn't do 5 or 10 years ago. That's what's amazing.
And that's amazing. And that I'm so excited that you're bringing these topics to our audience, because we talk about these things endlessly. And you're bringing a level of professionalism that just takes us to the next level. So I'm so excited for this conversation.
And what you talk about from your experience, I can, bring my own experience too, very similar. So in the 70s, as a pre-med biology major, the things that we were talking about in college, now, decades later, modern medicine still isn't really talking about them yet. It is a very slow process. And, Melissa can tell you too, I've often said that I think, we need to understand that health is our default state. That should be the natural state. And when you're healthy, your body naturally resists, infections, illnesses coming along. And that's another thing that, back in the 70s, in some of our classes, they were declaring that the germ theory of illness was dead. It's not germs or bacteria that cause you to be ill. It's when your body can't respond to them properly.
That's right. You're 100% right. Yeah.
So this shift from sick care, which unfortunately is still prevalent today, to preventive disease, of course, where we want to be. Why is it so urgent for us today to be having this conversation?
Yeah.
Why do you feel what's
Yeah.
happening in the world today and why we need to really get this message out there?
I mean, especially since COVID, people have understood the system is a little slow and doesn't always have a customized answer. So I feel like people are more aware of their own immune system now than ever before, and they're willing to invest in themselves. The medical system has a place I would describe that as crisis care. They're aware of it. And beyond crisis care, they have a huge medical setup, but they don't realize that it's more of the same. And in fact, preventive medicine is far better carried out by your personal trainer, good ones hopefully, your massage therapist, your chiropractor, your nutritionist. I mean, really, everybody that's involved with what you eat and your lifestyle is all preventive. And we have so much data on what you can do, more importantly, not only what you do in the order that you do it, whether it's your intermittent fasting or your cryotherapy or your hypothermia or intermittent fasting, high intensity interval training, walking, zone 1, zone 2, you name it. There's a lot of science. I think I tapped my mic. I'm getting excited. That's all right.
Okay.
Because we haven't talked about dopamine, because that's my favorite subject is dopamine. Can you get excited? Your dopamine goes up, but there's a healthy way to make your dopamine go up and not so healthy. But yeah, I think so. Preventive medicine is a science, and there are specialists out there, and even in medical residency, there is preventive medicine, but it's a small fraction of the bigger disease model. And it's a shame, and I'll try to stop talking so you can ask some more questions, is that what we don't realize that when health is gone, then you get the disease. And it's a very expensive proposition. I think what it is, in the latter half of your life, you spend most of the healthcare expense. In fact, I'll say it a different way. What I was told a long time ago, it applies now. The last 2 years of your life, you spent 80% of your healthcare dollars. Had you invested some of that, 20, 30 years ago, not only would you have been healthier, and you'd have been happier and more functional.
And that's it. That's what we talk about at Younger Body and Mind, is we want every day to be a happy, successful, vibrant, passionate day where you can live on purpose. That's where we want to take people. We're not just about fitness on Younger Body and Mind. We're talking about health and longevity.
And people, unfortunately, they don't see when there's the lack of something. It's very easy with modern medicine, like you said, for a crisis. You have a problem, you fix it. And so then you can see the result. When you prevent a problem, people don't often realize the benefit. They don't see the result because nothing happened. Yeah. Okay, and they don't realize what could have happened or would have happened if their lifestyle had been different.
It's interesting you bring that up, because increasingly the autonomic nervous system, that's the part of the brain and the spinal cord that seems to be your central nervous system that controls everything. We always knew it, but now we're understanding it at a deeper level. And so maybe I need to ask you that question, because I've been looking into that area more and more and more in order to come up with the solutions for the clients who have problems. And that is that, that the mind and body, the breathing, the tapping into the control. So maybe I'll let you lead, and we can share some of those.
Well, I mean, there are very interesting studies on the importance of breath. Often in classes, we teach Kung Fu and Tai Chi, and people, associate the importance of breath work with that. And so I always tell them, most important thing, remember to breathe, okay? But we know that breathing in and out through the nose has health benefits over mouth breathing. We have a whole sinus complex that was created just to filter the air and to condition it before it hits our lungs. And so we bypass that system if we're breathing through the mouth. And we also know that when you breathe properly, abdominally, the abdominal area, we can get into this more later, there are so many nerves there, it's sometimes considered a second brain. So there's a plexus of nerves in the lower abdominal area that's part of the parasympathetic nervous system that's responsible for that calming effect. And so when you breathe abdominally, you stimulate that area like a nice little massage. And so it has that calming effect on the body. You boost serotonin levels, decrease cortisol levels, so you're reducing inflammation, reducing stress in the body. And all of these wonderful benefits just from breathing correctly.
And that's exactly what science is showing right now. So it's almost like people had the answers. Maybe they didn't value it, but the science is bringing it to the front where if you don't value it, it's your own expense. So in fact,
Too simple.
it's too simple,
Breathing
but
well, is it too simple?
and I think that it's never too late. But as you get a little bit older, you'll find that you have to tap into that autonomic nervous system. If you don't tap into it, then even the conventional medical treatments, there's a lot of resistance. So people don't realize that the blood pressure is driven by stress. And I'll tell you why stress is a double-edged sword. Blood sugar is driven by stress. It's such a ubiquitous statement that people would poo-poo it. In the medical history taking, there is no mention of stress. When I used to see patients as a young doctor in medical school, that was a long time ago, but nothing's changed. Every time I sat with a patient with a crisis, whether it was heart attack or some kind of infection, they would say that stress was the cause. We didn't spend any time talking about that. We were taught to just move on to the next one. And even now, I don't think it's changed, but there's lots of evidence to show that the stress that raises the cortisol, that raises the norepinephrine, causes insulin resistance, which means that your insulin receptor doesn't work so well, therefore your sugars will go up. And in fact, they actually had a drug 30 years ago, which nobody knows about because it must be old, no good, which activated dopamine receptors in the brain.
Wow.
By activating the dopamine receptors in the brain, this is a drug, so it's been studied very, very well. Not only did it stop that cortisol surge, that's the stress response. So when you have stress, your dopamine is down usually. So when you have chronic stress in life and other bad habits, bad diets and so forth, the instant gratification, you actually are low on dopamine.
So would you be for, so dopamine is a happy hormone, right? Just for our audience, if they're not familiar with dopamine.
Right.
It's,
Yeah, I
feel good when they're
I'm
not-
going to agree
they're
with you, and I'm going to just tell you
Okay.
that just like everything in the body, that's the least of what it is. It is so profound that the dopamine in the gut and the dopamine in the brain and how it gets metabolized. But let's talk about dopamine. It's the most powerful antioxidant for the brain. That's an important concept. That may explain why in Parkinson's, dopamine is low, but actually it increased to reduce the oxidation and then eventually just ran out. Just like insulin resistance makes your insulin not work, your body has to make more insulin. That's the definition of insulin resistance. Then eventually it poops out. So what goes up must come down. And going back to the way you were describing many conditions is not about high or low, it's about balance. That's not very sexy. That's the fact. So what happens in disease is that your body compensates by going one way or the other. Disease is no more than being stuck at one place. So usually stuck at high blood pressure, high blood sugar, high cholesterol. But just as bad is being stuck low and you have low cortisol, low energy, and low everything. Neither one is desirable. You need to get the balance, and human body is a little more complicated.
so is that what integrative physicians focus on, such as yourself, right? Is keep maintaining the balance in the body?
Yeah, I was going to say,
Yeah.
I think people don't realize that, the human body is truly a miracle, the way we have these complex systems that work together. And so a lot of the things that we think of as problems, actually those systems are there because they provided a benefit. But when the system gets out of balance, the stress response, provided a real benefit. If you were being chased by a saber-toothed tiger, it was good that your blood vessels would constrict. So if you got bit, you wouldn't bleed as much. Okay, so the problem with most of these systems is not that one is good, one is bad, it's when they're out of balance.
Yeah.
So stress in short bursts has benefits.
Yeah.
But when we have chronic stress, that's where the problems come up. the system is now out of balance. And that is true, of so many of the systems.
Yeah, and as you correctly said, so stress in short bursts, the body can adapt, and it's the adaptation which is the success. When you're fasting, that's the stress, and your body adapts, there's a success. That's how we're figuring out longevity. It's temporary stress that makes the body, forces the body to adapt, which through evolution, that's what man had to do. So it's in our DNA. It's not like a technique that we just discovered. This is how humanity has been able to survive so long. So what we're finding is temporary stress is the way to optimize longevity. The only thing you have to be a little bit aware of is that if you have lots of chronic stress, adding more stress on chronic stress may not be the best thing. And that's why a little bit of biohacking is okay, a little too much of biohacking. I'll give you a perfect example of a young, fit CEO that came into my office just the other day. And I've known him for some time. And I'm just telling you his words. He goes, well, Dr. Habib, I've learned so much from you. So I went to those iCryo, those restore places. They have the hyperbaric, they have the cryo, and I just thought I could figure out which ones to use. And generally it's okay, but this is a CEO that's kind of pushed the envelope with hormones and other therapies, and he figured that I'm not feeling so good, I'll just do those things that are good for you. And he found that, not that they themselves are bad, but they may not be enough to solve his solution. So let me translate that. There are a lot of good therapeutics out there. But why I think medical doctors need to be involved is because we're good at assessing things and being objective. What that means is that all those therapies are great, but you got to know what it is that you're either treating or what is your goal. You have to know, and it's not just wishy-washy. You should be a little bit, the more clearer you are about the goals and the problem, the better you are with the therapies. And so I have a problem with medical doctors who do IV drips. I have problems with medical doctors that just do hormone therapy. I have problems with medical doctors that only do GI stuff. I have a problem with all of them because first we have to know what the problem is and what the goal is. And if you don't know that, then all those amazing therapies like intermittent fasting and hyperbaric and thermia. So, so I think that it's important for people to be aware, and then age as well. What is appropriate for a 20, 30-year-old may not be appropriate for a 40, 50-year-old, which may not be appropriate for over 65-year-old. So goals, and then your age, and then what is, and ways to monitor your progress.
So let me ask you a question. So what we're talking about, with that CEO going off and trying to, maybe address symptoms on his own by things he had read, but you focus not on symptoms, you focus on the system. Yeah. We talked about, everything being tied together, and it's a system, and that's where your focus is. Can you share a little bit more about looking at the body as a system and how you would treat it?
Yeah, and then actually people have coined the term systems biology. Okay. And we've always known it, but we've tried to isolate each system. So I would say that just repeat that question one more time.
Yeah, just looking at the body as a whole, as a system, instead of treating symptoms individually. Yeah. I think, we people read so much and they're like, I need to take testosterone. I need to do this. I need to do this one thing and I'm going to be fine. I'm going to treat this symptom. But they don't understand that the whole body is a system. And we talked about, regulation and falling out of balance. And, if you treat one thing, you're disrupting other things. So could you speak about the whole
I'm going to tell you the value of the symptoms. And that's where in a medical evaluation, we always start with the history. Then we do the physical evaluation. Then we do some kind of testing. Then we make a diagnosis, and then we have a treatment. Sounds so simple? That's the right way to do it. So doctors make the mistake of thinking that tests are superior, that the physical exam is superior. It always starts with taking a history. Now, whether that's the individual trying to listen to their body, I'm all for it. Our job is to help the individual understand what those symptoms mean. And that's where the pathology or the disease model fails, because we ask about chest pain on the left side. Is it crushing, central? Is it radiating down your arm? Does it go up your jaw? Do you feel sweaty? And if the answer is no, what do you find then? It's like, that's the problem. Because it's very defined, right? Whereas a real history is not like me talking too much, it's listening. So that was a joke. Doctors do too much talking. I love talking, as you can tell. But actually, when I actually sit with a client, after engaging with them about the weather and stuff like that, I just listen. In fact, I'm listening when I'm asked about the weather too, and the family. Because listening,
talk.
yeah, because they're going to reveal. And so one of the 5 symptoms that I try to elucidate, and it's 5 because it's easy, and not 5,000, because there's too many questions, right? And it's for anybody, young, middle, old, men, female, which is real simple. When you wake up in the morning, do you feel rested? There's a lot of people that don't feel rested. They slept 8 hours, they slept 9 hours, okay? And then when they wake up in the morning, that's kind of when they may notice more stiffness. What does that mean? It could mean inflammation, right? It's not normal. If you feel something that's not pleasant, it's probably not normal. That's why history is so important. Understanding or making sense of what you're feeling. Your body is the best machine ever. I think you said that. And it knows what to feel. It knows what to do. You just have to make sure that you don't get in the way. And so when you wake up in the morning, do you have energy? And is that energy constant, which is the normal way? Or is it kind of up and down? Like what they say, after lunch, I get a slump. Or in the afternoon, I need something. That's not normal. And then the other question would be like the stomach. Increasingly, what you mentioned about the autonomic system and the nerves in the gut being your second brain, it's all true. It's a two-way highway, one way down and another way up. They're both equally important. So it used to be that we would put a lot of emphasis on the body, and maybe the brain is 20%. Now they're putting a lot of emphasis on the gut and the brain a little less. I don't know. I think it's about 50-50. I have no idea. There's no point trying to figure it out. It's a constantly very dynamic thing. It's a dynamic thing. So going back to the final one I said about the gut, there are many symptoms. You don't have to wait until you got heartburn and gastritis and you've got pain in your stomach. You don't have to wait for all those. I think you have to ask yourself, do you have bloating? That's a really bad sign. Not bad sign that you got cancer or anything terrible. There's a lot of dysfunction going on. It's called dysbiosis. You don't have to wait till disease, like inflammatory bowel disease or Crohn's disease. You don't have to wait for disease. In fact, non-GI diseases come in the gut too. When you have changes in the gut where the bacterial balance is a problem, you can get problems in the brain. In fact, with Parkinson's disease, they 100% had gut problems decades before.
Found.
Yes, they just didn't connect
But
it.
doesn't that go to the normal labs that most doctors take? And so they can get normal lab results and then still have all of these symptoms that are unexplained by a normal, physician.
It's
And
big.
I would
Yeah.
like to throw in the opposite can be true too. So, for example, there are a lot of cases where people will have an X-ray for some other issue, maybe abdominal problems, and then they show some wear in the spine, and doctors say, "Oh, you're going to need a spinal fusion," but that person, their back doesn't bother them at all. No pain, and so sometimes there's a disconnect between the data and what it actually represents because people aren't paying attention to the history, the symptoms that people are showing. They're looking at the data, and you can have a false positive, you can have a false negative.
Both are amazing. You just covered a huge area right there. Is that matching your symptoms with what the underlying problem is, and what you just said. Testing alone may be actually detrimental because now there's a fashion to do a total body MRI because you just might pick up something. But what you said is that you're going to pick up a lot of false positive. What that means is that the test showed something, but it wasn't really very useful. It's false in the sense that it wasn't a cancer necessarily. It wasn't, you don't have back pain yet they find something. You're exactly right. So both are very, very important.
There's so much to this, this whole, but let me ask you a question, a foundational question is, so there's traditional medicine that we're all talking about and the things that we think are wrong with it, what they're missing. How did you make the decision to leave that path that you started on and now start,
I like to say it this way. I didn't leave.
Okay.
I was a doctor to begin with. I'm
you're
still a doctor now.
today, yes.
I never labeled myself with preventative
Okay.
or alternative. I'm a real doctor, and I'm going to make sure that I try my best to make sure every doctor becomes a real doctor. Because if you want to be a real doctor,
Is that really you're
that?
driving towards root
yeah,
cause?
the root cause, or I thought you said cause, both.
Okay.
I want medicine is too important to leave in the hands of people who are not getting it right. That's my cause. My cause is to stay a doctor forever, but using data so there is no doubt about what I'm about to say. Right? So we have data on the neurological stuff, on the fatty liver stuff, on the gut dysbiosis stuff. I mean, data that's literally coming in within months. We don't have to wait 5 years anymore. 5 months, 1 month, but it's just not being incorporated by the conventional medical doctors only because they're looking for a drug at the end of it. When there isn't, they kind of don't want to get educated because they become a little bit, what's the word? I mean, let's just be provocative. They become a little impotent. Like, you may say, you've diagnosed inflammation, but you don't have a drug for inflammation. What kind of a doctor are you? You've diagnosed dysbiosis, but you don't have a drug for it because drugs are not the solution.
Right.
You always had health. So what I found is most important about health is don't let things interfere with the health. There's lots of evidence to show that you don't have to eat fantastic foods 5 times a day. You don't have to be an athlete. You don't have to be. In fact, those people actually get into more trouble. I'll explain why later on when we have more time. You just have to stop things interfering. So when you have toxins that interfere with receptors, you're in a whole bunch of trouble right there. So when people are premenopausal and they got all the hormonal symptoms, I won't give a premature diagnosis. All I'm going to tell you is something's interfering with the hormones. It's not low, it's not high, something's interfering. It's called dysfunction. That's what happens with the gut. So you don't have to wait until you have Crohn's and ulcerative colitis and leaky gut. Even though leaky gut is more functional, I think that's the question you asked. I kind of slipped my mind. It's functional medicine. In other words, function has to go down low enough to become dysfunction. Dysfunction is when your body's trying to tell you, it's achy,
right.
I'm waking up with a fog, I don't have energy, I've got funny rashes, and the doctor does the test, which is the old-fashioned test. It's like it's a political term. Basically what they say is that it's like pig with lipstick. It's still a pig.
Right.
So it's the same old medicine, but they have these bells and whistles with MRIs and CAT scans, but still a pig. You just put a lipstick on it. That's what it is. And so I can say that because I can tell them exactly what they're looking for and how they haven't made progress. Because they're not looking at function, so the return on investment is very little. So all these drugs, they're good, but they don't give the return on investment because they never try to get the function back. So if you have disease and you have all the best drugs in the world, you can never get normal again. You cannot using drugs. You have to have, even if it's a drug,
I love that, though.
does it raise the function? And we have some,
Right,
by the way.
right.
So there are ones that activate mitochondria, but it's not well known. Just like the one I was telling you about dopamine. So it supports dopamine. So as the dopamine goes up, the sympathetic drive, the cortisol, the stress goes down, and lo and behold, the blood sugar comes down. And not only that, it prevented a heart attack. We had to wait 20, 30 years for the GLPs to say, I'll lower your sugar by making your insulin more sensitive. And it's the first time we've ever been able to reduce heart attacks in diabetics. Because until then, it doesn't matter how well you controlled your sugar. You're a diabetic and your sugar was perfectly controlled. You're a diabetic and your sugar wasn't controlled. They both had the same incidence of heart attacks. Like, how's that possible? One was controlled, one was not. Same with cholesterol. You can have 2 people, one with low cholesterol, one with normal cholesterol. The low cholesterol could have had the heart attack and the high cholesterol didn't because it's not a good marker by itself. So it's like hit and miss. You've got to have more detail. And so we talked about a lot of area there.
So,
But I think that goes
Yeah.
back to what we were talking about, the complexity of the systems. And I think too often medicine is still looking at a very rudimentary connection. So I can remember back with nutrition, they had the charts, or even in biology, they talked about the food chain. And they realized it's not a food chain, it's a food web, because there are all of these interconnections. And so some of the things you touched on, for example, you can have you give a calcium supplement because they have low bone density, and one person that works very well. Another person has no effect on their bone density. And I've always looked at it as that in that system, like I said, you cannot solve problems by just a drug. You have to look at the system. So it may be the person with the low bone density, they're not getting enough weight-bearing exercise. You give them calcium, the body still says, I don't need the calcium.
Right.
It does no good. You have to give them a reason for the body to say, let me utilize this calcium. So it's not as simple as, oh, the problem is low calcium. We fix that, the bone density problem is solved. No, there's more to it. So we have to look at the whole system of how the body works as a whole.
Exactly. I mean, just to continue that point would be that I think you asked this question earlier on, is that not only is it about the function of the heart or the gut or the liver or the immune system, but it also has integrated. So that's another term. So functional medicine, integrative medicine, systems biology. This is not totally alien to the medical world, but we decide to choose our own system. Like the cardiac system is just the cardiac system. The nutrition system is just the nutrition system. And by the way, this is disease level, so they've missed a whole bunch. But they have their system. But they, to be fair, this kind of knowledge wasn't there, 10 years ago, 20 years ago. It was emerging, should we say. But how each system communicates to another, and multiple systems are communicating. And the gut is a good one. So just to make it sense of what I just said, was that you eat something, whatever that something is, because we're going to argue how much protein and carb. Don't worry about it. Don't argue about it. You put something in. The reason I said don't argue about it, because you have no control in anything. Because the microbes, that's what I'm trying to say. The microbes decide what gets, So you can fight all day long, and there's some truth in fighting a little bit, because, we're people, we want to learn. But the microbes are so damn complicated that you may not want to fight too much. Just keep learning. And then we're not done yet. So the microbes determine what is broken down how into something. And that something isn't about how much amino acid gets in and how much carbs. It's actually even more powerful than that. It's called cell signaling. So when we talk about how kind of gut problem, most of them are constipated, get Parkinson's. Now, I want people to understand, just because you have constipation doesn't mean you're going to get Parkinson's.
Thank you for
I'll give you another. I know.
of
I better calm down a little bit. It's like,
you're making big leaps, which are wonderful. But I thank you for clarifying.
But I'll give you so many analogies.
Yeah.
This first episode is to get a broad view, to show the interconnections.
The importance of the gut microbiome.
Yeah.
It's everywhere in the news, so everyone has read about it. So I'm glad that we're
and we have to. And I have to say the next thing. I have to say it. That's cell signaling. So if you have good bacteria, we call them diverse beneficial, as opposed to not diverse, not beneficial, causing inflammation. Let's stick to the good stuff. The good stuff is the diverse stuff. So you eat diverse foods, your bacteria are probably going to metabolize it in a diverse way, and then you have something called short-chain fatty acids. Short-chain fatty acids can be used by fuel. Guess what? Who uses them? The cells in the gut lining. It's like they're looking for some fuel too. They're going to process all this stuff. They're going to try to prevent leaky gut. They're going to try to help that immune system that's waiting for it right underneath one cell thick lining. They need a little fuel too, right? So one of those fuels is short-chain fatty acids. And that's not it. There's more, right? It's like an infomercial. And there's more. There's a freebie. This short-chain fatty acids, they're amazing because they don't need a lot of help in crossing stuff. It's called MCT. Not medium chain triglycerides like coconut oil. MCT stands for monocarboxylate transporter. I just wanted to sound smart, but let's just say transporter, right? But the beauty is that the creator made the most important things easily transportable, and so these short-chain fatty acids can easily get to the brain, and they have a calming effect. You brought something up. Those gut and how they communicate with the vagus nerve, we just say it loosely, including me, that, this is, and then it goes to the vagus, and then it tells the brain, yes, but the microbes have a lot to say in all of that. The microbes are involved with that insulin resistance, with the inflammation, with the toxicity. All of that hodgepodge of stuff finally result in a signal that goes up the vagus nerve. So there's a lot of moving parts there, but to keep it simple, a good varied diet, diverse in fruits and vegetables is a good place to start.
So how do you translate that for all of the people listening here who are, we're certainly not at your level, myself certainly included. How do I translate that into actionable steps to be healthier, to get my gut where it's supposed to be, to feed my gut what it needs.
Yeah.
Like, where do I start? Healthy fruits and vegetables, yes. But
Yeah.
is there more? Can we give our
think
listeners a little bit more there? And
what you just said is exactly what we should summarize it a little bit.
Okay.
We can expand and finish on it. It really is that. But before the gut digests, you have to rest and digest. That means you have to sleep well. If you want to sleep well, you have to start the day right. So I wanted to actually leave one gem, because on your list you said that we should leave one gem. I'm giving it to you now, and I'll repeat it again. It's so important. So when you're thinking about the night, which is a big deal, most people don't volitionally, by choice, choose not to go to bed at night. At some point, stress and lifestyle and work and all those prevent you from getting it. When you've not had good sleep for a year and your doctor's prescribed you X, Y, and Z, I don't care what it is, you're not going to get your sleep back in a hurry. It's going to be really, really tough. So it's about prevention. Be aware of that your body was right. Now, I'm not saying the world is perfect. You could have had somebody die in your house. The work, your business could be going on. I get it. But understand that in order to work hard and fix all the family problems, take care of yourself. So the night is after the day. This is just me saying it my way. But, the truth is, the night comes after the day and the day comes after the night. So you're not wrong. You're not wrong. But I'm just going to tell you my way, So because now there's a lot about the morning ritual. There's a lot of science. So if you start the morning by getting the UV light into your retina, the retina talks to the brain, my circadian rhythm has started. If you know when the circadian rhythm has started, through evolution, you kind of know when the night's going to come, even if you don't, even if you try to sabotage yourself. And by day, if you've done what we just said, which is get the day started the right way with the sun, do the deep breathing, because your cortisol drive, that sympathetic drive, the one that can sabotage things and create blood sugar, blood pressure problem, there's science behind that. Couldn't say that 10 years ago. There's science behind that. You need to understand, and the doctors need to understand, you must prescribe what I'm about to say, even though it's free. And I'm going to say it again. It's free. So make sure you take advantage of it, because it's the best thing, which is do your deep breathing in the morning. It's called box breathing. Deep breath in slowly and even more slowly out. I just did mine in the morning, and I have a way to measure my heart rate variability. The more your heart rate variability takes place, the more your body can restore and get refocused, almost ready to supercharge, right? But if you don't recharge, you can't supercharge. That's the terminology I just said. There's an audience that likes electric stuff. In order to supercharge, you need to recharge. I'm talking about recharging right now. And then, so that deep breathing, I just want to tell you how powerful it is. There's also another component of the heart rate variability. The more heart rate variability, the more restoration, recharge. If you really concentrate or empty your mind, there's something called coherence. Coherence is the smoothness of the way the heart rate varies. So you can have heart rate variability, but it's even more beneficial. So in order to reach that heart rate variability, do deep breathing. And when I'm breathing in slowly, for a count of 3, then I breathe out for a count of 8, I'm humming.
maybe it's the vagus nerve, right? Also,
Yes. So deep breathing activates the vagus nerve. Being focused on not being distracted is objectively defined or can be objectively measured. And then humming and gargling. And before that, I start off when I wake up in the morning, because that's when cortisol, it's called the morning awakening cortisol response. For the first 30 minutes, it goes high, has to. So your blood pressure can be high enough, so when you get out of bed, you don't collapse. But it can be exaggerated in many people. So you can blunt that with a cold shower. If you don't like a cold shower, put cold water on your face. It does not have to be a cold plunge. That's a different phenomena, where we're lowering the temperature, hypothermia. In the same way, when you have hyperthermia, different phenomena, different time. But we said, what is the most important hacks is not one. But these are all easy, 5 minute, 5 minute, 5 minute. Wake up, get a cold shower or put cold water in your hair. Don't have your coffee right away. Do deep breathing, maybe in front of your coffee, with your coffee, if that makes you happy. And then try to, hum where you can.
So are all of these things we're talking about, ideas for how to lower the stress in our body? I mean, we're talking, I think I read that you said you called stress the silent saboteur. And, and so it is, right? It's there. It's part of, it seems to be socially accepted epidemic of our generation, in my opinion. So I don't know why we accept stress so readily. Everyone, I'm so stressed. I'm so stressed. You hear it everywhere. So are these just simple answers to getting ourselves in balance, starting our day the right way?
It's so important, and even a very powerful medical people are saying the same thing. So it's good that the people are identifying stress, but not to the point where they can't get out of it. So what I want to let you know is that stress doesn't come just from emotional stress.
Right.
Stress can come from inflammation.
Okay.
Stress can come from lack of sleep. Stress can come from toxic burden, like a leaky gut, allowing things. I say that, but it's actually more complicated than that. Where do you think those Parkinson's gets their toxins from? It could be from the air. It goes through the ethmoid sinus to the brain. What happens when some people don't recover from COVID? Because it went through the ethmoid bone to the brain and the toxins won't come out. So a lot of the chronic fatigue and I wake up in a fog is actually toxins not leaving the body. I keep going back to precise things you're asking, general stuff, which is really the right way to do it. But you can just talk so long about each individual stuff. And I think what we did multiple times is we brought in a lot of different parts of the body, because that's how the body works. Now, for the sake of the audience to learn and get a grasp, we'll slow it down. So having more episodes to talk about subject matter, but no matter how simple or focused the subject matter, we're always going to bring in a little bit of the reality, which is how it all integrates together.
Right.
And so I think we started with the gut. So the gut is already being sabotaged if you didn't start the day right, but you just didn't know it. And the gut is already being sabotaged because you didn't reset that sympathetic drive, which is highest in the day. Doesn't mean it's not there in the middle of the day. That's why me and my colleague, we go out to research things that can reset the body without having to do, yoga and Tai Chi for an hour, because they just don't have an hour. But we're going to learn about the benefits so you see the value and try to do some of that, whether it's the breathing or the movement, the control, but also use some technology where they have technology where if you put light through the retina, it just, the short answer, it resets the parasympathetic.
And you touched on an important part, because, Billy and I, obviously Younger Body and Mind, we teach fitness. We help people to, with breathing and, laughter yoga, Tai Chi, all of these things that help people, to feel better inside themselves. But they are also looking for quick wins every day. And we want to bring that too. So if they can, if it's getting the light, I sit out on my porch every morning, have my coffee, and just watch the sunrise, let the light hit my retina, because I've read, obviously, that that's a good thing to do. I do my deep breathing and prayer. People want that. They want the quick wins, and I want to bring that to them. I want them to also do, because we talked about heart rate variability, and that's something I track regularly. You certainly mentioned that in our first conversation, but I always tell Billy, when I see it go up the most is after I've done Tai Chi and laughter yoga in the same night. Laughter yoga is all about exhalation and breathing. And Tai Chi, the rhythmic movement, and the focus on breath work.
And when you were talking about the importance of that breath work, it brings up a phrase too. We often talk about, ancient wisdom for modern times. And so there has been a focus on breath for a long time. And in fact, some studies have shown there's a very interesting correlation that across these different cultures, if you look at yogic chanting, it puts your body into a rhythm that's about a little bit less than 6 breaths per minute. And then if you look at a lot of hymns that are sung, when you're singing, it puts your body into a rhythm of breathing around just under 6 breaths per minute. And then a lot of these different meditative practice, same thing. So it shows this has a powerful effect on the body, and through trial and error, different cultures have come to the same conclusion. And you were mentioning heart rate variability. Modern medicine, they take your pulse. It's high or it's low, it's so many beats per minute, that's it. But if you go to an acupuncturist, when they take your pulse, they're going to measure different qualities. They talk about how slippery it is. And really, what that is kind of doing is they were recognizing what now, modern people call, heart rate variability.
Yes.
So they're feeling that in the pulse as well. So there are a lot of these things that there was awareness of in the past. And it's not that all ancient wisdom is good, because, there are some bad things out there. People don't drink radium-infused water anymore for the energy boost of nuclear power. And that's not that ancient, but we learn, and so we're starting to recognize that there is real value in some of these ancient practices, that people discovered them without the technology, but had trial and error and an inherent awareness and recognized there was a benefit. Now modern science is catching up to say why those things are beneficial.
Yeah, I think what you described is an emerging field called energy medicine, where you can assess and also reset it. But just to put some context into what we're saying, in modern medicine, they want the heroic stuff. And naturally, I think people veer towards that, to be honest. But just in real practical terms, I was talking to another CEO that was supposed to come, but he had been through a friend who was supposed to come. I thought, let me send him a quick text as a reminder. Look, if he doesn't want to bother come, that's fine. I sent him a text, and he wrote me back a long text. I'm thinking he hasn't called me. He probably not interested in coming over. So this is like a top CEO. He owns a whole bunch of car dealerships. I can't tell you the name, and because that's his name. So we're very professional here, HIPAA. It's very professional here. And so he wrote a long text back. I'm thinking, whoa, he spent that much time. And I was going to send him a quick text back. It sounds like you're very busy. When you're free, call me. I thought, no, let me just write a little bit more. And I wrote down a little bit of what we were at. So let me repeat that. I gave him those hacks, which are not heroic, but I told him, and he knew who I am because he was referred by somebody. He knows how much, what data points I have. I was telling him, I know what you're going through. I went through something the same. My body was breaking down. It was a lot of stress, back to back to back. It was different types of stress altogether. Oh, I've been through it. But this is what helped me get through it. I kept my routine, and this is some of the routine I'm going to share with you. So I pointed down those things, like getting the light, 10 minutes, deep breathing. Even though my body was breaking down, I did zone 2 exercise. I did not stop. It wasn't a fantastic workout, but I did not stop because I knew that was going to help my mind to go. And the list goes on and on. So that I made sure I kept my balance. And I said, stay strong. Gave him the words of advice. And then he responded again after that. He says, I just got home. This is like 9:30 at night. He's the boss. He's coming home at 9:30. So bosses don't have an easy ride, by the way. Yeah, bosses are the ones, they need a little sympathy here. Yeah. And he hasn't had a day off, because the last time he had that day off was when he was playing golf with my other client, who had told him to come up, but he hadn't come in. I was like, let me send him a quick text. Maybe he's busy. He's like, he's going through a crunch. And he said, I saw your text. I'm just coming home. I'm just about to meet the family, have dinner. I saw your text, and I got so emotional. Because what I was responding to him is, I don't know the guy. He may not be my client, but I just shared with him,
helping him
as a human being, and it wasn't something heroic. Hey, buy my vitamin, get my hyperbaric chamber. I didn't say any of that stuff. And that I think is what we need to understand, is that we were made perfect. Don't let the environment interfere, because we will have an episode of one interference at a time, because it's just so many areas, right? And then just do the basics, but be regular about it. And stop and breathe. Be happy. Enjoy what you have that's free with family. I just had lunch with a good friend of mine. We met his family for the first time. Looks like we might like the family more than him. Give him the elbow. He's like, we found better people right now. I'm just kidding. And that is so good, not only for the soul, for the autonomic system. And I'm going to shut up. That's why doctors have a tough time fixing something, because they don't get it. You want to fix the human being, you better understand how the body's made up through evolution. Then that's why doctors like me will always win, because I understand that, and the data, and what I was taught. And
often the solutions are things that, like I said, not heroic. They're simple. But I always like to tell my students, when I talk about, the idea of being good at something is doing the simple things well. So I always remind what my Kung Fu teacher told me. He's in his 80s now, but he always said, simple is not easy. It's simple. Breathe a little bit, get a little sunlight, but to do that consistently. You know, it takes a certain perseverance, that dedication to do that. And often people don't want to do something simple that takes time. They want something simple. They want the magic bullet, the one pill. You know, you take this up and everything is solved, or this one procedure you get and it fixes all of your problems. But often simple things done consistently are really...
That brings up a good point. What is your approach to a patient who comes in and they want that one, that one pill or that one surgery or that one whatever to quickly move on? Like, what is because your approach obviously is bringing the body back to balance, the right way of doing it, getting and restoring what we originally had. How do you deal with that? Because it's prevalent today.
That is the most important thing. It's not the knowledge. It's not it's so. A couple of things. The first one I'm going to just knock out the way is that I try not to be judgmental, and so when people come to you, you have to meet them at their level, where they're coming from. That's why getting to know them a little bit is part of the history taking. No one ever said spend 5 minutes. In fact, the people that told me about 5 minutes was salespeople, that if you want to make a sale, you get to know them. It's like, I want to make a sale. I want that patient to follow what I got to tell them. Because doctors fail to sell their protocol because half the patients, it's been studied, don't take the prescription the way the doctor tells them because the doctor didn't convince the patient, didn't make a sale. If you want to make a sale, sorry, I just had to say it in direct and like,
I love it.
You know, lipstick on a pig. You just got to say the way it is. They want to be, because at the end of the day, if their patient fails, they are the problem because they didn't get a sale. The sale is to be able to convince the patient. So you got to get to know them. So as you get to know them, you have to meet them at their level. What happens that once you get engagement, once you get buy-in, once the patient feels like you actually care, which is not rocket science, but it seems alien in the medical world, once you get that, it's actually easy sailing. That first 10 minutes is better than the next 50 minutes. So if I'm doing a presentation, which I'm supposed to have been taught how to do, apparently, I don't follow instructions very well, as you can tell, which is that introduce yourself, tell them your story before you talk about the subject matter. If you haven't got them in the first 2 steps, they're not listening to what you are going to talk about, nor are they going to listen to what you want them to do. So I just bring up how many 3 different strategies or 3 circumstances. So when you have somebody that has problems, first of all, they have a problem. They came to you.
Right.
You got to be sympathetic. You got to build you got to care. You want to help them. You already sold it. That's why it's so easy for me. Because then the other part is just understanding your symptoms and how they measure up in the function. There are 5 stages of cell decline. Doctors diagnose in stage 4 and 5. That's a lot of decline before you got early diabetes or early blood pressure. So as it goes down, the body's telling you what to do. So you just listen to them. And then you brought this up. So I do remember what you said, which is that they do the wrong test. The tests that we do are for disease. Therefore, after stage number 4,
so they're not preventing it.
They're doing the wrong test. So how many times have you gone to the doctor and done the blood test? Everything's okay. The lab is okay, but you're not okay. You're still suffering. You got the same problems. And I laugh because it happens all the time. Literally, they're like obese and they're 300 pounds, no judgment, but they're overweight. They went to the doctor because they know they're not okay. No blood pressure, no diabetes, no cholesterol. That's fine. That's great. I'm happy. And the doctor has the goal to say everything's fine. It's like, the patient doesn't think it's fine. How come you think it's fine? He knows it's not fine. He's come to you because he's using the wrong test. So it's called functional testing. And so functional testing can look at hormones. Functional testing can look at the gut. Functional testing can look at the gut barrier, because when the gut barrier is gone, your blood vessel barrier is not far behind. Similar structure. When the gut barrier is gone, the blood-brain barrier is almost gone. Not very similar structure. They're very tight junctions. They have cells, and they have this very much similarities. And this is really beyond the doctors. Like, they got to wait until the sledgehammer says, yeah, you know, that's probably true, because they laughed at leaky gut.
Diagnosis.
They're just looking for the heroic stuff that they've been taught to do for so long. So you listen to the patient, you come up with the testing that matches their function. The testing, I always say, is not for me. I can show you what I'm saying. You're telling me this is what I think. That's how it started. Remember, I said, you take a history. then you do an exam, then the test, not the other way around. You don't do a test first. You don't do the CAT scan or the total body scan first. That's what they'll have you believe, that if you do a total body scan, you're fantastic because you just got everything done, but you just pointed out the biggest flaw ever. And that is not a simple thing. That's malpractice. Doctors hate it when you say malpractice because they think they run for the lawyer right away. It's like, hang on, no, malpractice means means bad.
Bad practice.
Bad, but they don't get it. They think malpractice is talk to a lawyer, and I think they should. But just kidding. I think that if you help people, you don't have to worry about malpractice. If you help people, you don't even have to worry about lawyer because a client, a patient wants to trust their doctor. They still have it. Just deserve it. And everybody will get along well. The lawyers will be out of business.
What do we do, though? How do we coach people not to always listen to what their doctor says? I'm going to give you an example in my life, and Billy is aware of this, because when I was testing for my black sash in Kung Fu, I was 53 years old, and I started developing lower back pain. And I remember telling you about it, and it was really getting bad. And so I went to a orthopedic surgeon, and her first, within about 3 minutes of talking to me, decided that I must have arthritis and compression of the vertebra based on my age alone. She didn't ask anything about who I was, what I was doing. And so I pushed back and I said, I doubt that's the case. Here's what I'm doing. Here's my lifestyle, which she didn't ask about. I'm testing for, black sash. I'm, very active. And she didn't want to hear any of that. I told her, but, she didn't take that in. We're going to do the MRI. I let her do the MRI. She came back to me and didn't find either of those things, no arthritis, no compression. She still wanted to do a cortisone injection into my spine. And I said, why would I do that if you didn't find any reason to do it? And her response was, well, our research has shown that we still get relief. I hung up the phone and I said, no way. I ended up fast forward to find a better doctor who, it turned out to be my IT band was, too tight. So big difference between what a doctor can tell you and wants to diagnose you. And if I wasn't, sure of my body and aware of, what I felt and, went along with something like people do, go along with things just because a doctor has the credibility and they must be right. So how do we help people?
This is the most important question right here. So I want people to really listen carefully. Everything we said is important. Mm-hmm. This is really important because I know how a doctor thinks. I've been a doctor for over 30 years. And a doctor has a really tough time admitting when they don't know the answer to something. That's a real problem, not for the doctor, for the client. Because all doctors are doing the same thing. When everybody does the same thing, nobody's getting sued. So what you've just brought up is where the doctor sees nothing in their specialty. They should word it like this. Now, I'm not trying to put words in that doctor's mouth. I wasn't there, so I don't want to judge. Right. I would just say that general scenario where everything looks normal based on the way we were taught and all the metrics we were supposed to go by. We don't find it. It's very hard to hear these words come out of doctor's mouth, except me, of course, because I do admit it. Which is this: I don't know what it is. But the reason I don't end up saying I don't know what it is, because I damn well go find out really fast. That's what I've been doing for Rethink Medicine for a long, long time.
And that's what the patient wants. I want a real...
You don't know, that's okay. There's nothing, there's no failing in that. Just go learn. But they won't learn because they have to get reimbursed.
Yeah.
And so that is the most important thing. The reason I say it's the most important thing, because then you'll do no harm. Mm-hmm. By injecting it, you might do harm. By testing more beyond, you might be doing more harm. Right. And you talked about very important things, how the top of the body affects the middle of the body and the lower body affects the middle. It's all interconnected. So it's not just different organ system, but the skeletal system itself. But I just wanted to labor this point one more time so people really understand that if they have a problem and it doesn't make sense for them, they shouldn't rely on the words coming out of the doctor's mouth. Not to not trust them, not to have a good relationship with them, just to understand that they're human. We're human. We don't know everything, but it's hard for a doctor to say that because we weren't trained that way. You're not supposed to not know. You're supposed to have the answer. You're supposed to be smart, but you gotta get real. Got to get real. Now you can just learn functional medicine. Just learn integrative medicine. If you do that,
So where are we on the scale of doctors understanding functional and integrative medicine? Like
All right.
what percentage?
I think you can
Because
come back to
I
the
agree
percentage,
100%.
But
Yeah.
I think we have a system that goes against that.
Right.
You know, it used to be in the early days, everybody was a family doctor. You know, you did everything. So everybody was kind of a generalist. But the system now kind of drives people to become specialists because you have that education to pay for. There's more money when you're a specialist. And then what happens when you're a specialist? You know, there is the saying that when your only tool is a hammer, every problem looks like a nail. So, you know, and they joke about if you go to an orthopedic surgeon with a runny nose, surgery can fix that. You know, they're gonna, you know, prescribe what they know. And so I look at that functional medicine is kind of reversing that. Instead of just specializing, you know, you're looking more at the whole.
Right.
Yeah.
And that's something medicine has moved away from.
Yes, yes. Everything you said is 100% right. I have a direct way of saying it is that you have to be a little careful with the physicians because they're accountable to what is reimbursed. So what is reimbursed is testing or drugs. So you have to be a little bit careful. And the other part is if you have a toolbox that's small, then you're going to get the things in that toolbox. In fact, how can you possibly get anything that's not in the toolbox? So what doctors have to do is make their toolbox bigger. That's one. I don't think that doctors should shy away from it. I know they hide behind we're licensed to diagnose and treat, but a lot of patients go to them looking for information on health. They should just say, I'm not versed in that, I can't help you. But they never say that, of course, you know, because they are obviously not obese. They obviously don't have blood pressure. They may not have migraine. So what I say is that if you're a neurologist and you have migraine, should you go to that neurologist? No. If you have a cardiologist and you have blood pressure, that doctor has blood pressure, should you go to that one? No, I'm being a little sarcastic because, you know, it's not fair. But it's true though, yeah, because I don't have it.
Right.
Yeah,
I
there
don't
you
want
go.
to be lectured by someone who's been doing it in their own life.
Yes.
It makes me, you know, question. But this is probably a good segue to talk about the difference of the testing that you would do as a functional medicine doctor, integrative physician, versus, you know, what traditional doctors do and how, because you're diagnosing things that they don't. So I guess I want to, you know, poke around there to understand better what you're looking at that they're not.
Yeah, so let's look at the crisis stuff. So if you're having a heart attack, then looking at the EKG can be very, very useful. If you don't have any symptoms at all, doing an EKG is not that useful unless it shows up something in the past or luckily you pick up an arrhythmia. I just bring it up. So there are, so most of the things that we test are good for acute care. But they've decided to extrapolate that and just say, no, we'll just use this and sort of make sure that that's great for prevention. Oh, you have arthritis. That's not prevention. You already got it. So basically, if we find something with our testing, it means you already have it. This is not what I made up. You have to have it for us to make a diagnosis.
Makes sense.
And now here's the funny part. What you said was comedic because it's the truth. And I just say medicine is comedic or it's a comedy because I'm telling you the truth, but it can't be the truth, really, Dr. Habib. It's like, oh, yes, it is. You're going to a comedian. And I mean, really, so with the testing, what I'm trying to say is that, there's a time and a place for it. You have to look at the age, right? There's no point looking at heart attack in a 22-year-old. Now, can it happen? It can, but it's not the first thing you look at. So there's certain ways for us to figure out that algorithm. Then what I would say is that, just like I say, that let's talk about the brain, even though it's not very common, but I already have this knowledge. When people wake up and they say they have fog, what does that really mean? There's enough evidence to show that from disease, we've been able to extrapolate. If you don't eliminate toxins from the brain, which only comes when you go into deep sleep, generally, then you wake up foggy. So fog is actually toxic buildup. It's one of them. There could be other things, right? So my point would be that if we had a brain scan, which I do, by the way, that means that if I look at your EEG and I make it functional, as you go through one thought process, I can see that one instruction has to ping from one side of the brain to the other, back and forth 10 times. Every time it pings, I can pick up the voltage, how strong it is. The stronger the voltage means more blood flow. And how fast it moves from one side of the brain speed. That also tells me connectivity. And finally, when you're about to carry out that instruction, which is usually click that button when you hear this noise, I can tell from the last impulse to the finger how fast it took. What I'm trying to say here is that we actually do have some of those tools. So when people come and say, I have brain fog, my brain is not working, this is not low-level people. These are high-level people. I don't try to decipher low level, high. I'm just trying to say that there's people and there's high level people, which everybody thinks that they're fantastic. No, they're human beings. They have problems too. They're just maybe good at what they do, or they achieve their success early on. They're just getting by right now. And so this is where I can help everybody, whether it's somebody who's mediocre, a child, middle-aged person, a professional, or an athlete, or an executive CEO. The point is that if you measure these things and you see that the brain speed is lacking, the blood flow is not there, and they have no diagnosis, we can still work on that. So that's one of the really important ones for functional, because the brain is so hard to measure. It's not like doing a blood test, which I can do a blood test for advanced cardiac, I do a blood test for intracellular vitamin levels, I can do a blood test for really complete hormonal evaluation. There's a ton of blood tests I can do, and urine and saliva, but I can't tap into your cerebrospinal fluid very often at all, unless you have meningitis, okay? So the point is that we are lacking that, but it's coming with technology and being able to match the right testing before the diagnosis, or even what they call early diagnosis. So I'll just finish on this point because it will just get your attention. By the time people's sugar go up, their insulin is already halfway down. Their reserve of insulin in the pancreas is already half gone, if I wasn't clear enough. By the time you get blood pressure, your nitric oxide level, this is a vasodilator, it's made in your blood vessel lining with the food you eat and the exercise you do. So nitric oxide, it keeps your blood vessels healthy. So that nitric oxide level has to be down by 50% before they say you have borderline blood pressure. My point is that couldn't your doctor measure that? They could, but they're not investing in it. They don't get reimbursed. Couldn't your doctor have measured some of these things before in advance? So there's many of these. NAD, nitric oxide, testosterone is not to look at low hormones to give you hormones. It's like you have chronic stress. I'll stop talking.
So based on you touched on something important there. You touched on the reimbursement by the insurance companies. Is that the major hurdle to adopting this type of medicine?
It can be. For two levels. One is you can't fault an individual to have paid so much premium to not use it. But you could go to 9 out of 10 doctors that keep making the wrong diagnosis. You keep paying your measly copay. You spend an hour of your day, or luckily, if you're lucky, more like 4 hours in a day, getting there, waiting an hour, seeing the doctor 15 minutes, and then driving back, half your day is gone. It's very expensive because the biggest expense is losing your health, and you lost your time. And then the copays add up, by the way. And when you get those testing, there's a copay for the MRI, there's a copay for the testing, they add up. Your insurance didn't cover 100%, not like they used to 20 years ago. So my point would be that, that your question was, is it because of reimbursement, right? Unfortunately, it's not spoken, it's unspoken, because why would you expect any different? There's no way this system can survive unless there's reimbursement at every level. The pharmacist has to get their money, the lab has to get their money, the radiologist has to get their money, the radiologist reading your report has to get their money. Look, let's not be unfair. Look, the doctor's not the only guy. He has to pay the receptionist and the medical assistant. So that's fine. All I'm saying is it's a system, but I think let's have honesty and transparency for what it is for disease, and treating the disease will never made you normal, never made you feel good taking 20 pills anyway. And the other one is that even if it's not reimbursement related, I think it's incumbent on the doctor to help their patient. I mean, isn't that our Hippocratic oath? After do no harm. I mean, that's too pathetic. How about helping the patient? Isn't that what everyone wants? That's
what we all want.
That's the Habib Hippocratic oath. I just invented that. Just like the 10-minute history.
I love it.
Don't talk about the medical. Just ask about the family. It could be 5. I don't mind. I'm serious. I'm going to make that into the curriculum.
I love it. We're laughing.
University.
So I can't believe an hour has gone by. And so we're coming to the end of our time with you today, and we're looking forward to future episodes where we're going to really drill down on some of these topics in detail. That's what we've talked about. But I want you to leave our audience with, we talked about that number one health habit that they should start today, that's going to, to get them headed in the right direction. What would be your number one? And if you want to add a few more just as a bonus,
Oh, no,
I'd love
no.
to hear that as well.
I need to keep it short.
Okay.
What you said. So, if you do 12 treatments versus one lifestyle, this is it. I'll repeat that again. 12 treatments, the gut, the hormone, the vitamin, the detox, versus one. Don't preserve your sleep. I didn't say build your sleep, repair your sleep, which may have to be done. You had it. You had sleep. Don't damage it. When you start to see it slipping, don't think about the night first. Think about the day. The studies are incredibly strong because we're measuring a lot of stuff, which cumulatively, that's the other thing you were about to say, that was part of the discipline and so forth, is routine. It may not seem powerful doing it once or twice or 1 week, but even by 2 weeks, and some of those gadgets which employ the deep breathing and the light can do it in 10 minutes. But you can't believe it unless you see it with the testing, is what I'm saying. So what I would say, think about the morning and the morning ritual. You know what's out there. Go YouTube it if you want. YouTube me if you want. I don't know. I may have some of that. But the point is that the other thing is do only one thing. Don't set yourself 3 things or 10 things. Forget 10 things. And that is advice to myself that I learned the hard way over 2 decades, maybe a little bit more, which is set yourself a few less targets so at least you can achieve it. When you set a target and you don't achieve it, that's the definition of stress. Now, that's my way of saying it. You can permutate that any way you like. That's what it is. When you set no standards, there's no stress. I'm so envious of people that have no stress. But I'm kind of generalizing. So the morning hack, the things we just said about getting the cold water in your face, the blunting that sympathetic drive by deep breathing, gargling, whether it's right that time or before your coffee, after your coffee. Get the daylight, not through the glass. It shuts out the UV light. It's the UV light which you've been demonized is the energy that you're looking for. The light spectrum is energy, their wavelengths, they all mean something, a little bit like energy medicine. There's a lot of science we don't know, but that's what I'm going to say. Sleep is the number one thing you do not want to damage. When you think about sleep, cannot forget the morning. And the one final thing which might be useful to really help somebody, if you have a hot bath 1 hour before you go to bed, that's been proven, evidence-based, that you'll have better night's sleep.
So it's sleep preservation through stress reduction and the tips that you gave through getting light, through breath work, and the cold water on the face, and even a warm bath before bedtime are tips to help preserve that sleep. We all need stress reduction. I'm probably number one in this panel here who needs that stress reduction. So these are all wonderful tips. So I thank you. Bill, any parting questions for Dr. Habib?
This has been wonderful, and I think this is kind of a little wide-ranging episode. But we hope to have you back and maybe go more in depth on some specific topics.
Yes, and if you would like to read more about Dr. Habib, you can visit his website. So it's nexthealthmed.com, nexthealthmed.com. Please go and take a look at his clinic. He has lots of tools that he has to help you. He is, a wealth of information as you're beginning to see here, and we're going to be doing this again. If you like this episode, please like and subscribe to our channel, please. Give us some feedback. We'd love to read your reviews and look forward to next time. Thank you so much for joining us. And thank you again, Dr. Habib, for being here.
And hopefully we can do an episode. We can come down and show people.
That'd be great. Look forward to that.
Thank you so much.
Bye-bye, everyone.
Take care.